Bokamper in the right place at the right time.
Joe Rose, touchdown Miami!
All right, welcome back to Out to Pasture, Joe. This is 8 episodes we've got in the books already. A lot of good people that we've had on. We've had Johnny Bench, we've had Larry Zonko, Jim McDuffie, Joe Theismann,
Yeah,
a lot of
great stuff.
A lot of sports guys.
A lot of great messages too, with health and people as we get older, things to take better care of ourselves.
And that's really what our show's all about. We kind of diverged a little bit, got a little more into sports, but now this is one that really I've been looking forward to because you and I have had some issues with our heart, and there's a lot of people out there wondering what to do as they're aging, getting over to the age of the people that we're trying to reach out. And so we're getting an opportunity. We're going to have Howard Bush, MD, interventional cardiologist at the Cleveland Clinic out in Weston, Florida. Really one of the great doctors that we've got in our country, Joe.
Yeah, and I got to tell you, working with the teams, we see him with the Miami Dolphins all the time, and Doc's helped us out a few times, man, on the road.
Yeah,
I mean, he's always there for you. Emergency room.
He was on call. You were in there. He was on call.
I caught him when he happened to be in there, man. It was great.
Welcome to the show, Doc. You had to jump down. You had to go downstairs, get in the elevator, and help Joe out when he had a little gas.
It's okay.
How you doing, Doc?
Thanks for the opportunity. My pleasure.
Hey, Doc, there's so many different things to talk about. One of the reasons we both have AFib, and I found out actually through you, and you put me together with some doctors at Cleveland Clinic for some of the stuff, and we're seeing it more and more. More of my former teammates, both, I find out from Bo, he had it, and I had it. A lot of guys never go get physicals to start with to even find out if you have it or not. Is it something that can get serious, Doc, if not taken care of? Can you talk a little bit about AFib?
So atrial fibrillation is an irregular heartbeat, and in reality, the upper chambers of the heart are beating so quickly that blood can stagnate. When I say stagnate, blood is at risk for clotting. So the biggest risk for patients with atrial fibrillation is a blood clot or a stroke, which obviously as you get into your 60s and 70s would be really devastating. So it's one of the few things we look for to try to minimize or prevent a stroke. There are certain patients that are more prone to atrial fibrillation, including, believe it or not, ex-football players.
Yeah.
And especially players or people with sleep apnea. So those are patients who we target looking for atrial fibrillation.
That explains why we're on blood thinners and heart pills and blood pressure pills and the whole package of things.
So when I was involved in it, my symptoms were shortness of breath. I couldn't, Doc, we go on the charter and you got to walk up the stairs to get on that plane. I'd have to stop halfway up and catch my breath. Then when I got to the top, I'd have to catch my breath again. And so I went in, and at first I had a cardiovert, which kind of tried to shock it back into rhythm. That didn't work.
No.
And then I went and I had the ablation, where they go up your groin and they burn it, I guess, is what they do, the damage in your heart. And for me, it was like night and day. After 2 days, I felt a lot better. But since I've talked to a lot of people, like you said, that have had it 2 or 3 times the ablation, it didn't catch, and then all of a sudden it catches, and some of them it never catches. So what is the difference between somebody like me who had worked on immediately as some of the people that maybe it's a little more extensive for them that continue to have the effects of this AFib?
So let's back up to your original complaint, which was shortness of breath and fatigability with exertion. So think of an 8-cylinder car working on 4 cylinders, right? It's not going to be very efficient. So people in atrial fibrillation, the upper chambers or the atrium and the lower chambers, the ventricles, are electrically out of sync. And, when does a baseball player throw the fastball? When the arm is in the best position. When does a carpenter use the hammer? When the arm is in the best position. So the heart is working inefficiently when it's fibrillating. And with the upper and lower chambers out of sync, of course you're going to be tired, fatigued, short of breath, no stamina. The cardioversion in reality works 100% of the time. It shocks the heart back into rhythm. The real question is, will it stay in rhythm? And in your case, although you went back into rhythm, you didn't stay in rhythm.
Mm-hmm.
What the ablation involves is called radio frequency, which is delivering energy to the pulmonary veins, and that's in the upper left chamber or the left atrium of the heart. And what they do is once they can isolate the veins with radio frequency, they create scar tissue. And that scar tissue, if any extra beats form, they can't travel, they can't propagate, they can't initiate the atrial fibrillation. So probably 80% of the time the ablation is successful on the first attempt. And fortunately for Bo, you were a success story after the ablation. There's about 10 or 15% that need a touch-up. In other words, the fibrillation comes back and they need another procedure. And probably 5 or 10%, the procedure won't work at all.
Well, so me, I think it was I think I may have been in AFib for maybe up to 2 years because it kind of seemed to gradually get worse and worse. So how does somebody know what are the first symptoms that you're in AFib? Because I've talked to people that they said, I didn't know for a while and just kept getting worse and worse. And I don't know that, so if somebody out there is thinking, the one thing that got me, I was watching a commercial and Kareem Abdul-Jabbar comes on and says, hey, I couldn't walk from here to 10 feet before I had to sit down. And I'm going, that's me. Yeah. And that's really what kind of got my attention on it. But if somebody doesn't see that or talk to somebody, what are the symptoms that you can think of to go and get checked to make sure that you are or aren't in it?
So again, exactly the symptoms you've mentioned already. It's fatigability, it's loss of stamina, it's shortness of breath with exertion, maybe feeling a little bit dizzy and lightheaded. And so many people today have watches or have devices where they can measure their heart rate, whether it's a Fitbit or something like that. So if you see the heart beating faster than normal, or it may come back if you have a blood pressure monitor at home, and some of these may read irregular heartbeat or unable to measure blood pressure, that should be a clue that maybe the heart is beating. So initially, atrial fibrillation is not only an irregular heartbeat, it's a rapid irregular heartbeat. So it's the combination of beating fast and beating irregular.
Hey, Doc, the other thing is old schoolers, you hear it all the time. I don't need a physical. I feel great. And for a lot, hey, in the business you're in, you don't get it checked, the old heart gives out, you're done. It's not a broken bone. It's the most serious thing. How often should you get checked to make sure that heart is working properly?
So again, it depends upon the individual, depends upon their risk factors, depends upon their symptoms. You've seen guys in their 60s who take great care of themselves. They're playing tennis at Central Park or they're walking around the track. Those people probably a little less often. On the other hand, if somebody's out of shape, they're sedentary, those are people that are at greater risk. So, I think a good physical, twice a year is probably reasonable.
Hey, Doc, and I got to follow it up. The heartburn one, it's embarrassing to talk about. I even say it on the radio sometimes. So I'm coming home and I have a heartburn.
A lot of stuff on the radio, Doc.
Yeah, I say some bad stuff on the
Doc.
Doc.
Don't listen to.
But Doc, it was heartburn, which as I've gotten older, heartburn gets worse. Hot dog is the number one. Just absolutely can't tell the difference in a heart attack and heartburn. But it went all the way through to my back. So I go to the emergency room and they send me to where you are, Cleveland Clinic, and I'm thinking, and the way the guy acted, like, hey, you need to get this checked just to make sure. It's a little scary, the message. And of course, I find out it's just from you. It was kind of embarrassing to be at the emergency room with heartburn. But Doc, that stuff, did I do the right thing, man? At least I knew, and I think I started feeling better like the next day after going through that thing. Do you see that with heartburn sometimes?
So again, number one, we'd rather have 100 false alarms.
All right.
And again, we'd rather be safe than sorry. So if anything is different, if anything is concerning, especially somewhere in the chest area. On the other hand, we're like detectives. We look for clues. What makes the discomfort worse? Is it worse with a spicy meal? Is it better with a Tums and belch? That's probably gastro. Is it worse when you're walking or doing physical activity? That would be a little bit more concerning for cardiac.
It's funny. Mine is combinations of, mine, Doc, is always combinations of like coffee and alcohol. I got all the combinations of knowing how bad it is now that I'm staying away from everything. But I don't know how much of it was the exercise part. But I got to tell you what, it scared the hell out of me, Doc, when, I was going through it and literally have my wife take me to the emergency room. Then a little embarrassing.
Well, again, to be honest with you, we'd rather have 100 false alarms. And again, most people don't know. And hospitals are filled with patients where we're not sure what's wrong with them. And, when you're 20 and 30 and 40, you want to know what's wrong. When you're 60 and 70, we can help people telling them what's not wrong. So you come to the hospital, the first thing they do is they say, listen, it's not cardiac. Well, then you're relieved. And I think that's a big part of it.
Yeah.
So, Doc, we've talked about a couple specific things, AFib, heart, heartburn and this and that. What's the most important thing that people of all ages need to know about heart health?
So I think we can put them either 1 or 1A, and it's exercise and diet.
Yeah.
And you guys have both raised families. You've made investments in your kids' education. You made investments in retirement. The best investment's your health. So we try to get young people early on to understand the importance of being proactive. And no question, what you do in your 30s and 40s affects how us guys live in our 60s and 70s. So I think the message is very clear that we're all going to be patients one day. And Joe, firsthand, Father Time is undefeated, right?
That's right.
And we're all going to be patients one day. And the goal is to try and delay that, to minimize it, to prevent it. And I think, again, the more we can work on exercise and diet, the better chance we have of all these issues.
Yeah. Bo, we got to ask him about blood pressure.
Let's talk about blood pressure a little bit. I remember coming into you and look, it seems like ever since I've been getting physicals, every time I go in and get my blood pressure at a doctor's office, it's always high.
Right.
And I always laid it off to being, oh, well, I'm nervous. I don't like going in and seeing the doctor and this and that. And I kind of, okay, let it go. So I actually go I go see Dr. Bush and we're talking about it. And he says, well, what kind of cuff do they use? I go, they just a regular cuff. He goes, no, you're a big guy. You need to put a big cuff on your arm. So you put the big cuff on my arm, my blood pressure comes down. And so, for years and years, I've been worrying about my blood pressure. He goes, no, they just need to put a bigger cuff on you. So let's talk about blood pressure a little bit and those kind of things.
So we had a Miami Dolphin player last year, no names to be mentioned, came in for the preseason physical, and his blood pressure was off the chart. Was somewhere in the 240 range, 240 over 140. I mean, high enough that you think he'd blow a fuse. So we began talking about blood pressure, and he says he's known about it since his days in college. But, Doc, they gave me some medicine. I didn't like how it made me feel. I don't need medicine. I feel great. And I said, well, wait a second. You're a young guy. You're in your 20s. Sooner or later, this is going to catch up with you. And that's why we call it the silent killer. So, again, very often people will not have any symptoms. And that speaks to the importance of going for an annual or semi-annual physical. But make sure the information, as Bo said, is taken correctly. If you got a big arm, make sure the cuff fits correctly. Take it 2 or 3 times. Look for the average. Many patients come in and they are nervous. And we call that white coat hypertension. You see the white coat, the blood pressure goes up. We can send patients home with a blood pressure monitor. See what it is in your environment, in your world. But again, if the problem is there, it's important to diagnose and treat it. Joe, you talk every morning about the men's health clinic in ED, and you're very transparent about it.
Yes.
Patients come in and they say very honestly, I don't want to be on medicine. Well, nobody wants to be on medicine, but there's no style points for the least medicine.
Right.
As you know firsthand, the style points are checking the boxes, getting everything where it needs to be.
No, it's a good point. Hey, so I've been on blood pressure medicine since I finished in my early 30s. My family has it. We have a history of it, and just to get it under control. And I remember when I finished the first year or two, I was getting massive headaches, and I couldn't figure it out. And right away, it was, diagnosed by the team doctor, and went back to him, and he said, hey, you've got high blood pressure, and you got it in your family. And I check, and everybody's taking a pill in the family, So I've been on it the whole time, but it's under control. But it really is important. And doctors will say, and I'm sure you're going to say the same thing, if you have high blood pressure and it's in the family and you need to take your medicine on that. Would you agree?
So totally agree. And again, a lot of times we can minimize the medication with certain things in our lifestyle. Again, as you can imagine, The things that are important are good diet, good exercise, stress reduction, obtain ideal body weight.
Got an emergency you taking care of there, Doc? We all right?
Hopefully we'll be right back in a second. There we go.
All right,
But
we
yeah,
just want to make
I
sure
mean,
you're all right. I thought that was an emergency going on right there. I was waiting for you to go down the first floor.
Someone had heartburn down on the first floor. They have to get you down there like Joe.
Listen, to show you how important you guys are, we've delayed all the procedures for an hour.
Yeah, there you go.
Hey,
So trust me, we're doing well. But no, I think the point you're raising is great. And again, blood pressure, many patients have no symptoms. It's part of aging. You know, in the old days, there was a stigmata that if you had high blood pressure, you were wired differently. Maybe you're nervous, maybe you're, you know, you're stressed out. And trust me, you can be totally relaxed and everything in a perfect place and still have high blood pressure.
So we're not like Joe's show, his radio show, where sometimes he takes call-ins. But I was sitting at the Dolphin training camp. I was sitting next to the great columnist for the Miami Herald, Dave Hyde, and I said, "Hey, we're going to have Dr. Bush on." He says, "Oh, can you ask him a couple questions for me?" So I wrote them down.
You got Dave Hyde questions from the Sun Sentinel?
From the Miami Herald. I think he's a Herald guy, isn't he?
Dave Hyde's the Sun Sentinel.
Oh well, whatever. It's, so they're both the same thing. I read both of them, so it doesn't really matter. Sorry about that, Dave, and sorry about it for the Sun Sentinel. So he asked me a question. He said, "Well, ask him why my blood pressure is higher in the morning when I wake up than it is later in the afternoon."
Well, again, and we hear that from some people, and sometimes it's, you know, maybe the sleep is restless. I don't know if he takes any medicine during the day. I have some patients who take a blood pressure, doesn't last 24 hours, the medicine. So the pressure may spike at the end. Yeah, again, everybody has their own cycle.
Yeah. And
that's why it's helpful sometimes we use this 24-hour blood pressure monitor. We can gear the treatment when the patient needs it the most.
Yeah. So this has been me. I'm one of those guys that doesn't like to take prescription drugs. I just don't. I feel like if I take this, then I got to take that to offset this and this one to offset that. Next thing I know, I got 20 bottles of pills on my counter. I don't like to. So I was talking to him. I said at one point on my blood pressure, I got concerned about it. So I went online and I looked, how do you get your blood pressure down naturally? And I did it for a number of years. So it was like 2 bananas, this and that, and eat certain things and do certain things. And my blood pressure went down. And so he said, well, why don't you ask Doc about that? And so what is the best way naturally, if you don't want to go through the medicated process, to get your blood pressure down? And it takes you got to be consistent with it. And it helped me get my blood pressure down. I followed it to a T. So is there a way to do that?
Come on, Doc. You get that food doesn't work on that blood pressure. Come on, Doc.
So somebody comes into my office.
That was great.
Somebody walks into my office the first time with high blood pressure, and I say, listen, the pressure is elevated today. We're not going to do anything for 3 months. Let's see what we can do with exactly what Bo said. And I call this lifestyle management. And again, it can be anything from stress reduction, cut the salt out, minimize the alcohol, 8 hours of sleep, you know, all the things that sound great in theory. In reality, it's very difficult for all of us to accomplish all of that. And then you go to plan B and plan C. But, you know, patients come all the time with holistic remedies, natural remedies. And trust me, as physicians, we're all for that. You know, for years, people would think it's the doctors against, you know, the natural people. Yeah. We all work together. And at the end of the day, whatever works. But if plan A doesn't work, then you got to look for plan B.
So Doc, we were talking a little bit, and so this is kind of the reason that we started this podcast. Last year when I was really having trouble with it, when I was really had my the shortness of breath was really bad, and we were in Kansas City where it was sub-zero, 20 degrees below or whatever, and I was doing a pregame show outside. I got back into the booth. Cardiologist called me and said, "Hey, Kim, I just saw you on TV. You don't look very good." And I said, "Well, Doc, I don't feel very good." And he says to me, "I wish I could get an EKG strip from you right now." And I said, "Well, Doc, I have this Apple Watch and it has an EKG thing on there, but I don't think it's very, I don't think it's very good." I don't think." He goes, No, they're pretty accurate. So I put my finger on the bezel like I'm doing right now, and I'm getting and it's taking an EKG on my wrist. And so it goes 30 seconds, And once it goes to 30 seconds, it automatically went to my Apple phone. I sent it to him, and he had my EKG strip in 30 seconds. I mean, a minute and 30 seconds, wow. He had my EKG strip. And he said, hey, I'm looking at your strip. You need to come in and see me tomorrow. 2 days later, I had my ablation, and I felt great ever since then. So the point is not what happened to me, but and that's kind of where I got it. So I'm driving down the road one day, and I'm looking across, and there's a guy in his car, 30 years old, and he's thumbing through he's like on TikTok or something, looking at girls in bikinis and golf lessons. And I'm thinking, this guy's looking for entertainment. I'm using my phone and my watch to save my life.
Yeah.
And so that's kind of what got me into this podcast, talking about aging and what can you do to keep going along. So I just want to get you talk a little bit about, because I think this is something you're an advocate of, technology that you have that's available now that can save your life in whatever they can do, blood pressure, EKGs, all the different things. Now you can almost get your whole body scan on some of these phones and stuff from a technological standpoint.
So 2019, it's a Saturday afternoon, I get a call from Troy Maurer.
Yep.
Miami Dolphins athletic trainer.
Right.
He says we have a former Miami Dolphin player in Washington, D.C. for his kids' high school, college graduation. And his Apple Watch has read atrial fibrillation. I said, that's great. Just as Bo said, you transfer it from the watch to the phone. You send as an attachment with an email. And I got within 30 seconds a diagnostic quality EKG. Immediately diagnosed atrial fibrillation. The guy's in Washington, D.C. Rather than sending him to a hospital, 48 hours of observation, missing the graduation, I said, get me a local pharmacist. We called him in a blood thinner. We called him in some medicine to slow the heart rate down. I said, have him go to graduation, come to my office Monday morning. And so that's exactly the story you just relayed from Kansas City.
Yep.
And we hear those time and time. So again, technology's there. Patients come and complain of palpitations. I can do an EKG that's 10 seconds. I want to see what's happening in their world. So we use these type of devices, again, to be an extension of, our ability to make diagnoses.
Doc, we always talk about the clogged arteries. And sometimes it's too late for guys, Literally, we hear a wife will say, oh, my husband, no symptoms. We had no idea. He just drops. I always think there had to be something, Doc. Didn't there had to be some type of warning and he just missed it, maybe a little pain, and he said, oh, it's normal. What do you see in that, Doc?
So again, I use the rule of 1/3. 1/3 of people with heart disease present dead. There is no warning sign. 1/3 present with a heart attack, certainly better than death. And 1/3 present with a warning, either in the form of symptoms. And again, symptoms, we look for clues. As we said, if you have a burning in your chest and it's with a spicy meal and better with a belch, it's probably gastro. On the other hand, if you're doing physical activity and you feel tightness, heaviness, burning, I've had patients coming in with a heart attack, and the first question I ask is, when did the pain start? And they look at you like you're speaking a different language. And they say, I have no pain. Well, they don't like the word pain. Pain sounds like a knife or something sharp. They have a burning, a squeezing, a tightness, a heaviness, anything that's in the chest, in the upper throat, in the back, that may be related to physical activity, emotional stress, should be a clue that something's not right. None of us can do what we did 10 years ago. That's part of aging. On the other hand, if you see a dramatic decline in your endurance, all of a sudden you can't do, less than 50% of what you used to do, that's a red flag. So again, I think it's just about being honest with yourself and then communicating, because eventually it catches up with all of us.
Great. That's a great call.
Yeah,
50%. Wow.
So when I first went in concerned about my heart and what was going on, I got put on a couple medications, and I got to put on, I don't know if I should say, Eliquis, which is a blood thinner. And what I was told about the blood thinners is this is the thing that's going to keep you from a blood clot throwing out and you getting a stroke. And then, look, I don't know about you, Joe, but for me, I'm deathly afraid of getting a stroke and being debilitated for the rest of my life in that kind of situation. So since I've gone through this and I went back for my 3-month thing, they took me off all the medications, even the blood thinners. I think, there's a heart scale of 0 to 10. Is that true, Doc?
So that's called the CHAD score. And the CHAD score
Right.
is a statistical analysis that tries to figure out your risk for a blood clot or a stroke.
Right.
And eventually,
So I was down like a 0. I was back down to a 0 with that. My blood pressure was down to like, 118 over 70, whatever. I mean, perfect blood. So he said, look, you don't even need to be on the blood thinner anymore. And so I've got off of it, and I'm really not on any medication now. But in the back of my mind, I'm thinking, well, can I just keep taking that so that if something occurs, or is that not kosher?
I mean, everything has a risk-benefit ratio. And what's the biggest risk of a blood thinner? It's bleeding.
Yeah.
God forbid you bump your head on something, you run the risk of bleeding. So if the benefit outweighs the risk, we recommend the treatment. And that's the value of this CHADS score. And you get a point for your age, a point for your blood pressure, a point for, your gender. And at your stage right now with a CHAD score of 0, then there's very little benefit of being on a blood thinner. So you don't want to take anything you don't need.
By the way, if you need Eliquis, you let me know. I got plenty at the house. You can get some.
No, it's funny you say that, because when I was on it, I'm a tall guy, and like a lot of things, I hit my shins on, and there's not much skin there, so when I was on that, I bumped my shin, and man, I must have had 10 bandages on my shins for the most of the time, just bleeding. I couldn't get it to stop unless I kept something on it. All over the place. Cut myself. And it looks like my jugular is kind of blowing up or something. But so it's but good. That's good. That's good to hear.
Doc, some good stuff, man. Really, really good stuff for us old guys today.
So I've got a guy. We've got a guy coming on soon. He's 99 years old. He's a World War II veteran. And he's been a bodybuilder his whole life. He just went on a cruise, just got off of a cruise. And I said, how was the cruise? He goes, I was in the gym every day. He brought his speed bag with him. He's doing the speed bag out by the pool and stuff. And he says, I'm trying to exercise as much as I can. But so people get older, quantity of exercise or how you don't want somebody overexerting if they're 95 years old, but you want them to do something. And there's a lot of different ways you can sit on your chair and stand up. Sit on your chair and stand up. Just do some of those things. Is there anything you could talk about people that are kind of getting older, where exercise becomes a little more difficult for them, that they can do to help keep that blood flow going and keep their heart healthy as much as possible?
I mean, that's a great question. I had a Navy SEAL come in about 6 months ago, and he told me what he did during his peak career. Now, fast forward 30 or 40 years. And I said, listen, reality, you've got to reinvent yourself at different stages of your career. There was a time Joe could play singles all day. Now he's got to play doubles. Pretty soon he'll probably be playing pickleball.
Boy, you're really hurting me now, Doc.
That's like a stab in the heart for Joe. He still thinks
I'm going to play with you, Doc, for saying that. I'm playing with you, and we're going to Century Village.
He still thinks he should be at Wimbledon playing right now.
But I think the point is clear that, again, you've got to reinvent yourself. You got to be honest with yourself. And it depends what your goals are. None of us are training for the Olympics. We're not training for marathons. We're training to stay healthy. So you do 30 minutes, 45 minutes, 2 or 3 days a week. And I have patients walk in the pool. Their balance isn't that good. They're worried about falling. Get in the pool and walk in the pool. I mean, they're doing something.
So we, our producer over here, Seth, he's kind of getting to that age, and I wasn't going to bring it up, but he was asking me, what about sex? What about vigorous sex? Is there an age where you got to kind of
I want to get more.
No, I mean, listen, I think everybody has different thresholds, but there should be, again, if you can walk 10 or 15 minutes on a flat surface, there's no reason why you can't engage in sexual activity.
Yeah. I do lazy sex. I just kind of lay there and let someone else.
Hey,
someone else
I think Joe.
Are you serious, Doc? I can't believe it. Doc's a professional guy. You're talking about you're gonna.
We're talking about real people, man.
Joe, like we're at in a beer. Doc's downstairs in the hotel.
Talking about taking those little pills for yourself. Don't
but that's more information than we need to know, or your audience needs to know.
Yeah, right.
Hey, Doc. Really appreciate it. I think a lot of good stuff, and I think for our audience, I'm really glad. I've been looking forward to doing this because I think we really want to get people that are of our age, the kind of baby boomers that are between 50 and 60, 70, 80, that are going through these struggles, and a lot of them. I just did a thing a couple days ago. I talked a little bit about AFib, and there were a lot of older people in there, and like two guys raised their hand. I go, I know there's more of you than those two. They're in this, and you probably don't even know about it. So I think it's a lot of good messaging for our audience, and we can't thank you.
Thanks, Doc.
And by the way, maybe one of the greatest men you'll ever meet in your life, nicest man you'll ever meet in your life.
Fantastic. So. Nothing like seeing you on the road with the team. It's great.
I'm going to give you one little
keep that going, Doc.
But Doc doesn't go on the road if we got to fly in two planes. He's adverse to that.
Not one plane.
He's adverse to the tag team flights out there. Give me on a big plane. That's the only way I'm going.
I'm going to give you one little bit of trivia. I'm the second guy on your podcast from Syracuse University.
From where?
Syracuse University.
Wow.
That's right.
Wow, that's fantastic.
Between Larry Zonk and myself.
That's fantastic.
You're good on camera. All the broadcasters come from Syracuse, right?
Yeah,
all those come. Did you dip into the Syracuse media classes anytime when you were out there?
I actually went there.
It got really cold up there in that godforsaken place.
So I went there to become a sports broadcaster, like Marv Albert, Marty Glickman, Bob Costas.
Yeah.
It was too competitive, so I decided to become a doctor.
There you go.
Doc, I think you made a good choice, by the way. I know it was a little more school, but it was a damn good choice.
Hey, Doc, thanks for being with us.
Thanks, Doc.
Man. Always a pleasure.
All right, guys. See you at training camp.
Seeing you. Okay.
Take care.
Joe, it's great having Doc on, man.
The best.
Best.
Known him forever.
Yeah.
And been so good to us.
Oh, you know what?
The old guys. Yeah. All of us, by the way.
You know what? I see him on the sideline. I go, hey, Doc, I got this. He kind of he always gives you time and lets you know. And look, we're very lucky in South Florida. Everybody, not just us, to have Dr. Bush, one of the kindest guys. And I've talked to him a lot about times. He said, look, he wants to know his patients. He wants to know a lot about them before he can diagnose them. And
you got great
kind of doctor everybody. Yeah, no doubt.
He talked to he talks to a couple of dummy series.
Yeah, well, that's
great.
I mean, he sounds really smart to us. Anybody sounds smart compared
Syracuse.
to us. Yeah. How about that, huh?
Unbelievable. Great
All right.
stuff.
Hey, look, if you guys like what we're doing, continue to follow us. You can go on all the platforms, podcasts. You can subscribe to our YouTube channel. We're getting subscriptions coming in all the time. You can follow us on your favorite podcast, the streaming platform. Joe, how do you get on?
I go to outtopasturepodcast.com.
There you go. How about that? Get a round of applause for Joe. It's the first time that he's got around. Outtopasturepodcast.com. That takes
easiest way to go.
That takes you to our website. And let's not forget our scales people here that are sponsoring our show for us. Everywhere I go with these shirts.
Now I'm going out. I went to Keys. I was wearing them the whole time.
Everywhere I go with these shirts, people are asking me, where can I get one of them? So look, if you want to get one, we'll get you. Next time we'll give you our email, and then you can send, and we can get you some of these shirts. But I'm glad you're following us, and got some good people coming your way. So stick around.
Some good teasers. Football season.
Pasture. Football season. I have a lot of stuff going on, and it's going to be a lot of fun. So keep joining us. We'll see you next time, guys.